Good evening, ladies and gentlemen. My heartfelt congratulations to the new initiates, to the new fellows of the American College of Surgeons, to their families, to their friends. I also want to extend my warm welcome and congratulations to the new honorary fellows, and my sincere thanks for those of you who chose to come in to this great celebration tonight. I apologize that some of you have to be standing, but that is just because this event is so meaningful to so many of you. In fact, there are few events in our lives that become permanently etched in our memories. Those events define for a person or for an organization a before and an after in their life cycle. Those are the events that make history. Tonight, we're gathered here to celebrate two such events. For our organization, the American College of Surgeons is a celebration of its 100th year. Indeed, on a night like tonight, in the fall of 1913, the college celebrated the first convocation, admitting 1,065 initiates from Canada and from the United States. For you, the new fellows of the college, this is an incredible celebration. It's an incredible achievement because not only did you manage to get through college, medical school, residency training, board certification, but you became sufficiently established in your communities to be recognized by your peers and elected to fellowship in this college. Tonight, I would like to highlight the significance of this event for both the college, our college, and the fellows. As for the college, it would be tempting to analyze its trajectory or perhaps some aspect of its illustrious history. But I have instead chosen a short video that speaks to the significance of the college. It reflects on the meaning of fellowship, and it shows us why we became surgeons. Let us play this movie. I hope I hope you feel as proud as I felt in 1982 when I became a fellow of this college. I also hope that our organization's shining path will illuminate the path forward for all of us. And now let me turn to you, the new fellows of the college. You are exceptional and you are diverse. In fact, you are exceptional because this group, totaling 1,622 initiates, is one of the largest ever admitted to fellowship. And I have to extend here my sincere thanks to Patricia Turner and the Division of Member Services for having achieved this beautiful group of people that is here tonight and that makes this huge room look so small. You are diverse in age, gender, interest, and origins. As for your age, you span generations X, Y, and the baby boom. And while the majority of you are below 50 years of age, tonight we welcome 24 new fellows that are older than 60. As for gender, 321 of you are women. And I know that this number is far from what we want to get to. But let me tell you that there's been significant progress, and to witness that, this is tonight the largest number of women admitted to the American College of Surgeons in one single group. As for your interest, you represent 14 specialties. As for your origin, 1,276 of you are from the United States and Canada, and 346, as Dr. Freischlag pointed out earlier, from 55 countries around the world. To wit, 110 from Latin America, 111 from Asia, 72 from the Middle East, 37 from Europe, 4 from Australia and New Zealand, and 12 from Africa. So, following the tradition started by my predecessor, Dr. Brent Eastman, I would like to pause here for just a moment and ask that each one of you introduce yourself to the person on each side of you. Please, do that. I hope you have all met someone who will become a friend for the rest of your life. So now I want to talk to you about your future. And I do not pretend to have a crystal ball, and I would very much prefer to have a conversation with you rather than give a lecture, but due to the physical impossibilities of the former, we have to settle for the latter. I believe that the lessons that I have learned in my work as a surgeon and my involvement with the American College of Surgeons will be useful to some of you as you move into this new era of your life, the one after fellowship that I referred to earlier. There are 3 general aspects of your future I would like to touch upon. First, I would like to describe for you some major forces affecting the practice of surgery in the course of the next decade or two. Second, I want to convince you tonight that you can shape your future, that you can craft it, that you can define it. And third, I want to suggest to you that this college, your college, provides you not only with the best and most comprehensive platform to leverage your quest in shaping that future, but also provides you with a set of values that can serve as your moral compass. To accomplish this task, I will reflect on the past as needed, I will examine some aspects of our current practice, and when discussing the future, I will describe it as I wish it to be. aligned with our noble mission, a mission that has not changed in the course of our history and that I believe should not change in the next 100 years. So let me start with the major forces that impact your future. Some significant forces are changing the way we practice surgery that I believe will significantly impact the way you practice in the next decade. I have chosen tonight 3 examples that will affect you equally, regardless of country of origin or site of practice. These external influences reflect, for the most part, advances in medicine. And I'm not here to criticize them, but rather to describe them. Surgeons need to know and to understand them so that they can position themselves and the profession to face those challenges. And there are challenges, but I'm an optimist, and to paraphrase Winston Churchill, I'm a firm believer that every challenge also represents a great opportunity. Let me start with the first one, innovation. The introduction and adoption of new ideas, techniques, and devices has resulted in monumental progress in medicine and surgery. And you know that. But for many years, the pace at which innovation occurred allowed for intervals of time to test and to validate the new idea, and when useful, to design educational and training methods that ensured its safe adoption. In some ways, it resembled a trip down a river with some rapids, interspersed with waters of relative tranquility that allowed you to recover. The pace of change has increased substantially over the last few years, and I predict that the pace will only accelerate in the future, the equivalent of navigating permanently in wide waters. So it is not the change, but the nature and the pace of that change that poses a significant challenge for the surgeon of the future. Think about it. On the one hand, many innovations end up in failure, as they do not survive the test of time. On the other hand, failure to seize an opportunity can have catastrophic effects on the surgeon's practice. Therefore, decisions need to be made fast, and they need to be made right. Dr. Jerry Fried, one of the regents of our college, suggests that when faced with the dilemma of whether to adopt a new idea, technique, or device, the surgeon should ask 4 basic questions. Does this innovation fulfill a clinical need? Does it add value to the existing options? Is it financially viable? And, very importantly, can it be adopted by the average surgeons with relative ease? Your college, through the program committee and the Division of Education, under the absolutely excellent leadership of Dr. Ajit Sachdeva, is constantly scanning the horizon for new ideas and developing appropriate programs to train its fellows. The meeting you are about to attend starting tomorrow, with its many offerings, is just one example. The network of accredited educational institutes that your college created, and which now extends beyond the United States and Canada to include Europe, Asia, and the Middle East, is another example of the rich platform you can use to advance into your future. Adapting to rapid change and learning how to choose the right path is as imperative to your survival and growth as avoiding boulders and finding the right currents is to those navigating in wide waters. The second of these 3 is as specialties of medicine developed, is the issue of blurring of the boundaries that I call. As specialties of medicine developed over the last few years, they did so within well-established boundaries. For example, when I became a surgeon, the practice of surgery, it was clear that there was a delineation between what I did as a surgeon, primarily open operations, and what most medical specialties did, primarily diagnostic and non-invasive therapy. However, in the latter part of the last century, as innovation led to the development of new ideas, methods, and devices, the boundaries between specialties started to blur. The treatment of common duct stones, once the domain of the general surgeon, became part of the practice of a gastroenterologist. The treatment of intra-abdominal abscesses, the placement of a central venous line, done only by surgeons in the past, was now in the hands of interventional radiologists. This instance, at least some of them, resulted from our failure to seize on new opportunities. Many surgeons felt that retreating to the operating room and continuing to use the tools of the past was better than retraining and embracing the future. These boundaries continue to fade away, and my prediction is that this process will accelerate in the future. We see signs of it when we look at who cares today for our complex patients in an intensive care unit, or who uses the new endoscopic techniques to treat incipient mucosal cancers in the gastrointestinal tract. I believe that surgeons should think of themselves as uniquely qualified to perform interventions, any kinds of interventions done in any way that the patient needs. Interventions that may be done through the open approach, through endoscopes, through percutaneous approaches, or through natural orifices. Surgeons, in essence, should become what Tom Russell, former executive director of the American College of Surgeons, coined interventional biologists. And I'm happy to say that we have made progress in this arena. General surgeons are continuing to develop minimally invasive approaches. More recently, the vascular community has transformed itself from a traditional open approach to the image-guided endovascular approaches. These changes have had major impact on the survival of patients with vascular disease. We must continue this strategy. As I see it, the intelligent surgeon of the future will be someone who embraces the management of diseases, not just the use of techniques, and will also be someone who becomes knowledgeable and masters diagnostic and therapeutic aspects of his or her specialty beyond the traditional boundaries. In other words, turn the tide in our favor and become absolutely, totally knowledgeable about our practice. The third major force that will impact the future of practice of surgery is society's increased concern with improving quality while controlling the cost of care. Given that the practice of surgery involves greater risk than most other specialties, preserving and improving safety and being able to measure quality in a reliable way will continue to be an essential part of our practice. Furthermore, since we do utilize substantial resources to fulfill the needs of our patients, our institutions and our society at large will put pressure on us to be accountable for those expenditures. Michael Porter has defined value as the ratio between outcomes and costs. In this book, Redefining Healthcare, he urges us to focus on outcomes and to measure them, as he says, systematically and comprehensively. As we do so, I predict that the measurement of outcomes will switch from its current focus on objective outcomes as determined by the profession to a focus on outcomes as determined by patients and by employers. For example, when undergoing spine surgery for back pain, it will not just be demonstration of fusion of the vertebra on x-rays, but the relief of pain and the ability to return to work that will matter. When undergoing anti-reflux surgery, it will not just be normalization of the esophageal pH, but complete relief of heartburn as perceived by the patient. This, my friends, is what I believe the new accountability of our craft. Accountability for quality, for safety, for cost, for outcomes. And this cannot be done by individuals acting alone. It requires the development of teams, high-performance teams. These teams require leadership. And I was so happy to hear earlier Brian Santin saying, this is an opportunity for surgeons, and explain to you the meaning of leadership as he saw it, as he represents one of you and the future for the college. And we're talking about a leadership that is different than what we exercised in the past. This is not authoritarian leadership. This is a leadership that fosters exceptional communication, mutual respect and support, and the development of the best and most straightforward ways to achieve the goals of our mission, improving the health of our patients. This is an area that needs your direct involvement. And the smart surgeon of the future, in my opinion, will be one that devotes a substantial portion of his or her time to the study of leadership, to the development of emotional intelligence, and to the improvement of the so-called non-technical skills. Your college is deeply involved in these areas and has already developed an infrastructure to support it. I encourage you to get involved, not only because it will help your future, but because it is the right thing to do for our patients and our society. Now let me talk to you about the future. It is my hypothesis that to a great extent, each one of us has the opportunity to create the future. Each one of us has the opportunity to create the future. True, there are external influences, some of which I described earlier, over which we may not have total control. But our direct involvement will help to modulate those forces and change the outcome that otherwise they would produce. Of course, there are pessimists who will tell you that the sky is falling. They usually start by pointing out how much the world has changed, how perfect things used to be, and how little reward you are likely to get for the many hours you will be working. Furthermore, they will suggest that there is nothing you can do to change things. They will portray us, surgeons, as victims. I ask you, using the words of General Colin Powell, to reject the easy path to victimhood. It is unappealing to the rest of society and it leads nowhere. Instead, I'm here tonight to tell you that the path you have chosen, which is the same one I chose, is a most rewarding one, and that given the chance, I would do it all over again. Indeed, I feel extremely privileged for having been given the opportunity to touch so many lives, for having my patients entrust me with their absolutely most valuable asset, their health. And I'm here to tell you that there is not enough money that you can count in the world to provide that kind of satisfaction. The satisfaction of helping another person in need. I'm also here to tell you that the future is not predetermined, that your future can be shaped and that each one of you can make it happen. In fact, what you do makes a difference. As Jane Goodall says, you have to decide what kind of difference you want to make. You may not be able to achieve everything that you want as you work to define the best system that will fit the needs of your nations. But you should set for yourself the highest goals, the absolutely highest goals, and then move in that direction for as long and as far as you can get. This is the only way to make a difference, one little bit at a time. So the next time you see something that is wrong, something that needs fixing, don't blame the system. Get involved instead of that. Follow the advice of the famous Indian philosopher Rabindranath Tagore, who said, "It is better to light one candle than to curse darkness." And then exercise your leadership. Recruit others to light more candles, and sooner than you know it, you will have illuminated a path for a better future. Your college, your platform, and your moral compass. Let me talk to you about my last item. I hope that through my talk tonight I have shown you the many areas in which your college, under the excellent leadership of the Executive Director, David Hoyt, has developed an infrastructure to help you deal with the forces of change. Whether it is through the division of education, filling the gap between your practice and the current state of knowledge, through the division of research and optimal patient care, with its measurements of quality, safety, cost, through the division of advocacy and health policy, to help modulate the implementation of policy and that influence the provision of health care, or through the division of member services with its focus on you, on your work, on your practice, on your chapters, on your projects. The college provides you with the right platform to exercise your leadership. My call to action today is for you to get involved, and to get involved now, not waiting until you become older, but to get involved now when you have the energy to do it and the beliefs in a better future. At this stage of your life, to help your patients by defining what is an ideal future. Now, as you travel this path, you will need to have a moral compass, something that you can use to guide your actions and to help you distinguish right from wrong. Again, the American College of Surgeons, in this case, the American College of Surgeons staff, has led by example this last year when, through a thoughtful and well-defined process that lasted 6 months, they identified a set of values that they have made their own. These values, I believe, reflect not only the ideas of the great staff of our college, but I hope they also reflect their observation of the values expressed by so many surgeons with whom they have worked so closely. As I have had an opportunity to examine them, I realize that they speak for me as a surgeon as much as they speak for our college staff. I offer to you tonight the 5 values that they define. Professionalism, to exemplify the highest standards of honesty, responsibility, respect, and accountability. The importance of professionalism to us surgeons was beautifully highlighted by President Lamar McGuinness, who is sitting here on the stage tonight, in his presidential address when he pointed out that it is, and I quote, what sustains us, embodies us, invigorates us, and carries us forward. End of quote. To me, personally, professionalism is about caring. It is, as Peabody eloquently put it, at the heart of medicine, because your patients will not care to know how much you know until they know that you really care. Excellence. Our staff believes that excellence represents an aspirational goal, the goal to always exceed internal and external standards and the expectation of others. I can think of very few values that associate closer with what we surgeons do every day than excellence. The relentless pursuit of perfection in everything we do is the hallmark of a surgeon. Innovation, defined as the pursuit of creative and forward-thinking improvements to transform what we do for the better. We discussed earlier how influential this concept of innovation is for your future. Introspection, defined as the attitude which, through reflection, allows human beings to explore their mind and their soul to define gaps that will motivate them to seek continuous self-improvement through professional development, self-assessment, and awareness. Inclusion, which our staff define as the active engagement of all appropriate individuals and entities to collaboratively harness collective intelligence. Now think about that, to collaboratively harness collective intelligence. This is the kind of team that Brian Santin was talking about earlier. The value of inclusion in today's world cannot be overemphasized. Just respecting our differences with others as a matter of courtesy or moral standards is not enough. We must embrace those differences. We must celebrate them, and we must cherish them as they are the vehicle to collective intelligence and creativity. I encourage you to do that. But at the same time, please listen to this. I ask you not to forget who you are and where you came from. This is not a matter of letting yourself disappear into a melting pot. You have to preserve and you have to cherish what's different about you, your accent, your beliefs, your ways, your values, your ideas. Because respecting and embracing others can best be done when you have respect for yourself and for your own values. I believe it is time for us as an organization to embrace other organizations closer than we have in the past, with like-minded values, so that physicians can learn to work together and to provide in this environment high-performance teams. It is the only way, by gathering the minds and the energy of all involved, that we shall succeed as a profession and as a society. So here you have the 5 values, which, for those of you who have a mathematical mind, I have summarized on this formula, P plus E, IQ, for each one of the words that I gave you. Now, every recent president has had a theme for his or her year. My theme for next year is the surgeon of the future, anchoring innovation and science with moral values. And I offer to you humbly the values I described to be used as your moral compass. Ladies and gentlemen, as I reach the end of my remarks, I want to congratulate you again on achieving fellowship in this great organization. You can now proudly use the letters FACS after your name, meaning that you are a fellow of the American College of Surgeons, or as my dear friend, former President Jerry Healy so nicely put it, a forever a caring surgeon. There are many challenges ahead, but I hope that I have convinced you tonight that we can face them together and succeed. We are all in this together. You should trust what is inside you. I trust you. And as Christopher Robin said, I hope you will always remember, you are braver than you believe, you are stronger than you seem, and you are smarter than you believe. You, my friends, believe me, you, my friends, have the power to change the world. So go do it. Thank you.